Good morning, everyone. Thank you so much for joining us. My name is Erin McPherson with WMAR 2 News, and today we are talking about the Safe DV program at Greater Baltimore Medical Center. Now, Safe DV stands specifically for Sexual Assault Forensic Examination and Domestic Violence. And through this webinar series, we are wanting to educate the community about domestic violence and how we can help maybe some people who are on this right now, or maybe someone that you know, and also just potentially to prevent something from happening. So getting the word out there, starting the conversation, continuing that conversation. And GBMC has had educational experiences before in person. Because of COVID, that is not possible right now. So we are doing this virtual webinar series, and this is one of them, especially since October is Domestic Violence Awareness Month. That is why we really wanted to highlight what the Safe DV program does at GBMC. And to help me really dive into what this program is, we're going to be joined now live by Rosalyn Berkowtiz. We are going to refer to her as Roz today. She gave me permission. I can say the nickname, but Roz is a forensic nurse examiner at GBMC. Over 18 years of nursing experience, has worked as a forensic investigator in Maryland for 9 years, and her resume just goes on and on with her experience in this field right here in our community. Good morning, Roz. How are you doing today?
I'm fine, Erin. How are you?
I'm good. Thank you very much. And thanks for taking the time we're going to dive into a lot of things on this webinar today. So first, can you just tell me exactly what the Safe DV program is at GBMC?
So our Safe Domestic Violence program provides forensic medical evaluations for patients who are victims of sexual assault, domestic violence and strangulation, child abuse, both physical and sexual child abuse, and human trafficking. We have nurses that are on call. We are available 24 hours a day, 7 days a week, 365 days a year. Our patients that come in also see an advocate. In the domestic violence piece of it, they provide safety planning and also help them with referrals and providing resources for our patients.
And so when we dive into this, I do want to let some people know that this program will contain references to sexual abuse and intimate partner violence. So viewer discretion is advised if you continue on this webinar with us, but it is a very important topic. So we hope that you will continue this discussion with us. Now, Roz, when we are talking about domestic violence in our community, I mean, looking at some of the statistics for how many people this program helps, 400 people annually, and the average, the age range as young as 6 months old and up to 98 years old. I mean, looking at those statistics, that was pretty shocking to me to see that age range. And I think it's important to discuss that so people know this can happen to anyone, anywhere, at any time.
That's correct. And domestic violence specifically crosses all barriers: gender, age, race, ethnicity, and socioeconomic status. It can be anyone. It can be your sister, your cousin, your brother, your next door neighbor. You don't know. Okay.
With COVID, it's been a very unique time for everyone, but how has COVID specifically impacted victims of domestic violence? And briefly, I think a lot of people are familiar with the national case of Gabby Petito, who was traveling with her significant other at the time and then was reported missing and then later found dead. So how has COVID impacted domestic violence victims?
So it's interesting. When I was reading a recent article about Gabby Petito's case, I came across a quote from Dr. Eve Valera, who is an associate professor at Harvard Medical School, and she studies intimate partner violence and brain injury. She stated, during the coronavirus pandemic, intimate partner violence and its severity has skyrocketed. At GBMC, we saw an initial dip in our victim numbers during the height of the pandemic, but we knew that this was indicative of people advised to stay home, not that cases of domestic violence were disappearing. Unfortunately, we knew that this meant victims were trapped at home with their abusers and not able to seek the help that they needed. And even if they wanted to get help, they were afraid to come to a hospital because they were afraid of being exposed to coronavirus. Although at GBMC, we worked out a specific plan for during COVID, where patients, instead of going through the emergency department, were screened by phone prior to coming in, and then were able to come direct to our department, where we would get them registered and do everything there in the safety and security of our program, and they were not exposed to any additional potential patients. So at GBMC, we initially saw a dip in the number of our victims. There were many additional stressors during COVID as well, which adds to domestic violence. The stress of being at home and together 24 hours a day, 7 days a week. The loss of jobs, the financial stress, children being home all the time. Children were not in school and were not able to confide in the school resource officers or the counselors about either the abuse that they witnessed at home, but also about the abuse that they may have experienced themselves at home. Cases we saw during that time were much more severity, much worse injuries. However, this year, so far, our strangulation cases are up at least 30%. So I think we're finally starting to see the impact of everybody being stuck at home together and not being able to come in for help.
And you mentioned strangulation. So I don't think a lot of people think of that right away when they think of domestic violence, or maybe people don't really want to think into detail about what it actually means to be sexually abused or in this type of situation. So can you explain what exactly that strangulation is?
So strangulation is the blockage of airflow or blood flow by applying pressure externally on the neck. It is very common, and up to 68% of victims or survivors of domestic violence report having been strangled at least once during their relationship. It puts these victims at 750% more likely to be killed by the partner that strangled them. So it is very high lethality. And the problem is that our patients don't understand what strangulation is. So we have to go into more detail to explain it to them. Because most people think that when you're strangled, you died. And when we ask a patient about it, they say, well, I'm alive. So no, I was not strangled. So we have to explain in more detail. Did somebody apply pressure to your neck? And the problem with occlusion of blood flow or blockage of blood flow is that then you can no longer get oxygen-rich blood into the brain. Brain cells are very dependent on this oxygen, and they die quickly without oxygen. In domestic violence, it's also a method of power and control, and it's very effective because victims say that next time they will listen because they're afraid that next time they could die from being strangled. It only takes 5 to 10 seconds of pressure applied to the neck, with an average of 6.8 seconds to render someone unconscious. And about anywhere from just over a minute to just over 2.5 minutes of maintained pressure, and that person can die. And it's very surprising. Most people don't understand. It only takes about 4.5 pounds of pressure to occlude the blood flow out of the brain, the jugular veins. It only takes about 11 pounds of pressure to occlude the carotid arteries. And if you want to relate that, it takes about 20 pounds of pressure to open a can of soda. So you can kill someone by strangling them using less pressure than it takes you to open that can of soda. There are many long-term effects from strangulation as well. People that have been strangled can have a tear in the blood flow, a tear in the carotid artery. And part of that normal healing process is for a clot to form. There have been many case studies of victims of strangulation who have had a stroke 3 months and even a year after being strangled, because that clot that was healing the blood vessel, a tiny piece of it broke off and traveled to the brain. These patients are young, and this could be a debilitating incident for them for the rest of their lives. They can also have a traumatic brain injury from death of brain cells from lack of oxygen. They can have damage to the vocal cords, and they can die from strangulation.
And I mean, I'm one of those people in the population that when you think of strangulation, you think that that means that that person died. So, I mean, to hear the numbers being that high and the consequences of just a little bit of pressure, I mean, that really puts it into perspective. Opening a can of soda is 20 pounds, you said, compared to it only takes 4 pounds. I mean, that is really eye-opening in that essence. Now, when it comes to legislation regarding strangulation, so how that is held up in court if someone were to be found guilty of something. So what is your experience with legislation around strangulation over the past several years, initially trying to get strangulation to be first-degree assault statute to present? Can you explain what that means in layman's terms and how that handles in court?
Yes, I can. So a felony assault, a first-degree assault, carries with it 25-year potential of 25 years in prison if they are found guilty. We have been trying to get strangulation added to the felony statute since 2012. In 2020, it was the fourth attempt, and the Maryland State's Attorneys Association, I partnered with them, and I was able to get probably about 15 letters of support from various agencies and various organizations. And in January of 2020, I was able to go to court, and I testified before the House Judiciary Committee and the Senate Judicial Proceedings Committee to add strangulation to the felony statute in Maryland. We were the last of 4 states, and I can't understand why it didn't pass prior to this. On the day that the Senate Judicial Proceedings Committee was to vote on it, myself, one of the state's attorneys from Frederick, and a forensic nurse from Frederick were called back to speak to the chair and the vice chair of the Senate Judicial Proceedings Committee and to educate them further on strangulation. And in March, it passed through all of the houses and all of the votes. And in October of 2020, the law went into effect. We are just starting to see cases from then going to trial because of COVID closing the courts for so long, there was a backlog of cases. So we're still seeing some cases from 2019, but now we're starting to get into some of the 2020 cases. I testify in 3 counties as an expert witness, and all of the counties are the same. They're just starting to get to clearing up the backlog.
And obviously, we would have liked to see this added into the court system as a charge earlier, but at least it is there now. Yes. So that is at least a positive, that the continued push, now it is there. Now, we did get a question from someone in the community asking what are current laws to protect victims. So we touched on some of the things with strangulation, but are you familiar with the current laws to protect victims at this time?
There are so many. I am not the expert in that. Mm-hmm.
We can always, we'll have information that on the GBMC website, which we'll toss to later. We tons of information there, so we can definitely reach out to that person and give them a proper link or things to follow up. So we will definitely look into that. So
and the state's attorney's office could be a resource as well for that.
Perfect. And with your experience in this field for so long, working directly with people, being an expert witness, you've had to then train others to be a part of this. So how important is that from your experience, your knowledge, everything that you have learned and done over these years? How important is it to pass that expertise along to really help other people in this field? So the importance of training and who else you've trained.
So I think training is very important. I think with education comes knowledge, and with knowledge comes prevention. So we do a lot of community education here at GBMC. But in addition to that, I have done probably about 65 trainings so far in Baltimore County and about 8 surrounding counties. I have trained the police, the state's attorneys, the judges, medical providers, forensic nurse examiners, the fire department, both their first, the first responders in the fire department and the emergency medical services system. So I've done many trainings, and I think that is really important. GBMC goes above and beyond the walls of our hospital. Anybody who is on this call that would like some additional training in strangulation, please refer to our website where there is a form to fill out. And we would be happy to provide it.
And touching on that with the training other resources in the community, knowing what to look for. So is there something that an everyday person in the community can keep an eye out for? Are there physical signs or things that they can see?
So unfortunately, with strangulation, visible injuries, the latest research shows that visible injuries are present in less than 50% of the cases. So most of these cases are based on signs and symptoms. And some of those might be neck pain. It could be a raspy voice. It could be voice changes. It could be visual changes. So if they say they saw stars or spots and then everything started to fade and went black, those are things that they experience, that people experience just prior to passing out. So that loss of consciousness, they could have trouble breathing, trouble swallowing, pain with swallowing. There are so many. When they come in for a medical forensic examination, we screen for all of these symptoms. And then when we testify, we tie these into the research.
And there was someone who asked a question. I'm sorry. There was someone who asked a question who was essentially touching on what we just said. What are physical signs and symptoms, especially for people with dark skin when you may not clearly see bruising? Is that something that you've had to, if you've experienced before? How do you handle that?
We handle that 2 ways. If we see something very faintly, we can use what's called an alternate light source. It is a tool that will enhance the visibility of an injury. When you're looking at light, regular everyday light is white light, and it's made up of many different waveforms. So with the alternate light source, we filter out a lot of the wavelengths of light, and we use ultraviolet light. The blood under the skin absorbs the light, and it provides a contrast from the surrounding tissue. So it will enhance something that we can see faintly. We also palpate the neck, looking for areas that are painful. Our patients, many of them are followed up with the police department, domestic violence coordinators. And with those follow-ups, if they see any injuries, because sometimes bruises can blossom, they can show much better in a day or 2 or a couple days later. As these domestic violence coordinators follow up with these patients, then they will also take additional photos if that happens.
In along with you briefly mentioned something about police. There was a question from someone who said, if a victim is being abused by a partner but needs healthcare, can they come to GBMC without police notification?
Absolutely. The adult population, domestic violence is not a mandated report. So they can come in, they don't have to report to police. We have a protocol in the emergency department for medical and radiographic assessment and evaluation for treatment of non-fatal strangulation. And they will follow that protocol regardless of whether they want it to be reported to police or not. They will ask them, would you like us to call the police? But if the patient says no, the police are not called. So yes, they can come in to be evaluated.
Do you want to just get a quick plug, since we are talking about this? If people do need resources, there is a private hotline, 443-849-3323. Again, that number 443-849-3323, or you can go to gbmc.org/safe-dv. So those are some ways that you can get resources. And as Roz mentioned, 24/7, 365 days a year. Now, is there a way that an audience can help someone who might be in danger, or how can people actually help someone?
So first of all, the most important thing to remember is not to say to somebody, you need to leave this situation immediately. Because when domestic violence victims leave a situation, it is the most lethal time in that relationship. It's sort of like, well, if I can't have you, nobody else will. And this is when victims can be killed. The most important thing is to put them in touch with a program, have them come in or call and speak to somebody. And our advocates will provide resources, but they will also help them safety plan to help them leave the situation in a safe manner.
Do you also find that with many victims, a lot of the times they tend to go back to that person, or there is a bond that they have with that person? So just helping it over time is the way to get away. How do you cope with someone who is very attached to their?
The problem is that it takes about 7 times of speaking to someone before they finally decide it's time to leave the relationship. They are in love with this person. They are often blaming themselves. Oh, he wouldn't have done this to me if I made dinner right, or if I had it on the table on time, things like that. So they don't see the abuser as the person in the wrong, and they're in love with them. So it does often take a while for them to decide, yes, it's time to leave. And they won't leave until they're ready.
And that can be hard for family and friends who might be able to see those things. But as you mentioned, it is the most dangerous to say, leave, get out. So I think that's a really important note to tell people, because I think it can be hard for, obviously, the person in that situation, but the friends and family witnessing it and not know how to handle it. So GBMC is a great resource to be able to help not just potential victims, but also friends and family. Now, there were a couple more questions we got. Well, first, was there anything else that you wanted to add about how people can help, or did you finish that?
Well, I think it's important, if they know that they were a victim of strangulation, to try to encourage them to come seek medical help. They need to be evaluated, because they can have, for example, a tear in the carotid artery, and they may never know it until they have a stroke down the road. But it can be prevented by treating them medically. So it really is important for them to be evaluated. And I just want to reiterate, there are no charges for the services provided from the Safe Domestic Violence Program. The forensic exam for strangulation is free to all patients.
I think that is something I definitely should have mentioned at the beginning, so I apologize there. But yes, these services are free, and that is a huge a huge help for people in this community. A lot of people, when they are going through something or have a health problem, maybe not just this, but money is a concern. How can I afford this? How can I do this? So the fact that this program is free for these people is huge. So a huge thanks to people in the community and all of the donors who have been able to help this program be able to be here for those in the community. I think that is, yes, again, it's all free, and a huge thanks to everyone who has been able to fund this program.
I would also like to thank the generous donors and supporters of our program, because without you, we would not be able to offer these services for free. And I would also like to thank our CEO, Dr. Chassar, and our leadership who enable us to offer comprehensive services and encourage us to step up when there are gaps in care for our community due to other programs closing or other funding being cut.
And we do have a few more questions from people in the community watching. Do you provide services in Spanish?
We have a language line. We have our discharge instructions that we can print in Spanish, but we have resources that we can print in Spanish. And we also have some that are specifically for Spanish speaking that we can give them. But we have a language line that will translate everything as we go.
So you can be sitting with someone who speaks in a different language, and that will translate right away.
Yes.
Perfect. So yes, if you are listening right now and you speak Spanish, you can get assistance at GBMC. Another question, are there programs for educating teenagers about domestic violence, sexual assault, all of the above?
Yes, there are. We do a program that is about teen dating and healthy relationships.
And is that information that is probably on your website?
Yes, yes. There should be a list of resources, of programs that we can offer to come out and teach. Just go on the website and fill out the form, and we'll be happy to provide whatever they need.
And we were asked if you could talk more about the trainings. What types of groups does the program work with? So I know we mentioned how you work with first responders and judges and a lot of different other people in the community, but if you could just talk a little bit more about those trainings and the groups that you work with.
So aside from the people that were just mentioned, I recently started training the community. So it's a little bit different, but it is a community training for non-fatal strangulation. And actually, I recently did one through the Baltimore County Public Library. And
And that's why we're doing these educational webinars. So this is something I believe GBMC is doing quarterly. So we have this in October, really focusing on this program and your expertise specifically. I know we touched a lot on the strangulation aspect, and then there's going to be a few more. So we're going to continue these educational webinars because educating the community is a big part of spreading awareness and hopefully prevention. And there was one question I missed earlier. Does a victim have to press charges for someone to be arrested?
For someone to be arrested, they need to at least report to police. And then the state's attorney will take it from there, because it is really the state that is prosecuting this abuser, not the victim. However, the victim will have to be there to provide testimony for court.
Is there any, and this is not a question on here, but talking about testimony, I know it can be a scary experience for someone to talk about what happened to them, traumatizing. Is there ways to help victims cope with that, or to maybe not be in the courtroom when they testify? Are there ways around to help them relive this experience?
The Baltimore County State's Attorney's Office is wonderful with that. They have court advocates that are with the victim from start to finish. They are with them in court. They provide support. But it is important for them because the person being charged has the right to face their abuser. So it really is important that they go to court, but there is a lot of support that is provided for them. And counseling trauma-informed care counseling will be recommended by the advocates as well.
And there is one thing I wanted to add that I didn't mention earlier, just that GBMC is the only hospital in Baltimore County that provides medical forensic sexual assault treatment for adolescent and adult victims, and the only hospital in Baltimore County and Harford County that provides this treatment for children 12 and under. So that this focuses on re-empowering survivors in order to begin the healing process. And we've used the word victim a lot, but I think it's important to also say survivor.
Survivor.
Right? So
I agree.
We know that when going through something like this, it can be considered as a victim, but getting through this and getting the help makes you a survivor and coming back on the other end of things.
Absolutely.
There was another question. What outreach are you doing specifically for the trans and gay community?
We are not doing any specific outreach because, like I said, this crosses all boundaries. We will provide the same training to everyone. There is no discrimination.
Perfect. Now, is there anything we've discussed a lot of things in the last half hour or so about this program, about your experiences, legislation, what people can do to help? Is there anything that you feel that we missed that you wanted to touch on that you really want the community to know or to get from this webinar today?
I think we covered everything, just that if you know of someone who is being abused, please encourage them to go to a hospital or to call and speak to somebody from the domestic violence program, just so that they can begin the process of healing.
Absolutely. And I just wanted to take the time to say thank you personally for all of the work that you do in this community to help these survivors get to that level, as well as the entire team at this program at GBMC. Again, we thank the community and the donors for everything that they do to be able to have these services for free in the community. And we just thank everyone also for being here today with us to be able to hear the expertise from Roz. And is there anything else that you wanted to add? I know we can see if there's any other questions that will pop in before we sign off.
I would like to thank the audience for participating in this webinar. It's an important topic, but it is a very sensitive topic. And it is a topic that a lot of people don't want to speak about. And again, I think with education comes empowerment and prevention. So if you learn about this and you speak to somebody that you think is being abused, maybe you can help them. Domestic violence homicides are up in Maryland. So it's very important that everybody should be educated and everybody should look out for their friends and their family.
Absolutely. And again, if you or someone you know needs assistance, GBMC Safe DV is open 24/7, 365 days a year. The private hotline 443-849-3323. Again, that number 443-849-3323, or you can just head over online, gbmc.org/safe-DV. There's also another one listed on here that's just gbmc.org/DV. So I think no matter which way you go, you'll be able to get to that website and get some assistance. And
now I'm sorry.
No,
that hotline,
yes,
there is not someone here during night hours to answer it. You can either contact the emergency room. You can call 911 if you want to come to the hospital and you don't, and you have no way of getting there, or you can leave a message. And when our staff comes in first thing in the morning, they play the messages and we'll call you back. But if it's not safe for them to call you back, make sure that you let them know not to call you, that you will call them that day yourself, because we can't always contact victims of domestic violence. Their phone could be monitored by the abuser. It could be tracked by the abuser. Sometimes it's just not a safe situation.
So if it is an emergency, your best bet is to call 911.
Yes.
Absolutely. And during those business hours can come right over. But even since it is available 24/7, that 911 will be able to connect to the proper resources to help them through the situation.
Yes.
Awesome. And again, so call 911 if there is an emergency. That number or the website, gbmc.org/safe-dv, a ton of information there. And this was just one of the educational webinars. We will be having another session in December. So we will be able to make sure we send out those details to you when it gets a little bit closer, which it's only about a month away. So thank you again, Roz, for everything you do, for what your team does, and for taking the time today. Thank you to the audience who has joined us today, asked those questions, and is engaged to help spread the word, help get this education out there, and hopefully prevent someone from being injured. And thank you again to the community and the donors who make this possible to have these resources available for free. Well, thank you so much, and keep an eye out for the next webinar. We will be posting all of that information. So thank you again, everyone, for being here today, and we look forward to seeing you in December for some more educational resources.